Hey everyone, ready for another deep dive? Today we're looking into AI and radiomics.
Yeah, this is pretty cool stuff, actually. Especially for all you students out there thinking about the future of medicine.
It really is like a glimpse into the future, right?
Yeah.
We're using some lecture notes from a bioengineering course as our guide.
And it's fascinating stuff. Trust me, we'll try to break it all down in a way that makes sense, even if you're not a bioengineer.
So let's set the stage. Radiomics.
Yeah.
What is it? In a nutshell, it's like taking medical imaging and combining it with really in-depth analysis, like what's done in genomics.
Exactly. You're taking those images like X-rays and CT scans, but then going deeper, extracting tons of information to understand what's happening at a cellular level.
So we're not just looking at a picture anymore.
Right.
We're analyzing the data within that image to get a much more detailed understanding.
It's about uncovering hidden patterns and insights that we might miss with just a visual inspection.
This is where AI comes in, right? But before we jump into that, can we back up for a second? I know a lot of people get confused with all the terms AI, machine learning, deep learning. Can we break that down?
Sure, it's like a hierarchy. Think of AI as the big umbrella, the overall concept of making machines intelligent.
Okay, AI is the big picture.
Then you've got machine learning, which falls under that. It's where algorithms can actually learn from data to improve their performance.
So machine learning is a type of AI where the systems learn as they go.
Right. And then within machine learning, we have deep learning. This uses something called neural networks, which are kind of like complex structures inspired by the human brain.
Okay, so deep learning is like machine learning, but more complex.
Yeah, it's about going even deeper, uncovering those really subtle patterns and connections that we might not see ourselves.
Got it. So deep learning is the real brainiac here.
You could say that. And when you apply these powerful AI techniques to medical imaging, that's where the magic of radiomics really happens.
Okay, so radiomics is using AI to analyze medical images. But what exactly are we looking for in these images? What kind of information can we get?
Well, radiomics extracts a ton of features from images. Things like the size and shape of a tumor or the texture of a tissue. Even subtle variations in intensity that could indicate a problem.
So we're not just looking at the overall picture, but zooming in on the fine details.
Precisely. It's about finding those hidden clues within the data that might point to a specific diagnosis or help predict how a patient might respond to treatment.
That's amazing. So we're going beyond just seeing a tumor. We're analyzing its characteristics to get a deeper understanding of it.
And by building statistical models from these radiomic features, we can potentially revolutionize how we diagnose and treat a wide range of diseases.
This could change everything.
Yeah.
But let's talk about the images themselves. What types of medical imaging techniques are we talking about here?
There are several key players in the medical imaging world, each with its own strengths and limitations.
Like different tools in a toolbox.
Exactly. We've got X-rays, which are great for visualizing bones. Think fractures or breaks. They're fast, relatively inexpensive, and widely available.
But X-rays aren't so good for soft tissues, right?
Right, they're limited in that sense.
Yeah.
For a more detailed look at internal structures, we often turn to CT scans.
CT scans give you those cross-sectional images, right?
Yeah, they're perfect for visualizing things like tumors, internal injuries, blood clots.
But CT scans involve radiation, which is a downside.
That's true. Then there's MRI, which is amazing for visualizing soft tissues, especially the brain and spine.
And no radiation with MRI, right?
Right. MRI is a great option for those who can't have radiation exposure, but it can be a bit more time-consuming and expensive than other techniques.
And there's some people who can't have MRIs because of metal implants and things like that.
That's an important point to remember.
Oh.
So yeah, each technique has its pros and cons. We also can't forget about ultrasound.
Oh yeah, ultrasound is often used during pregnancy.
Right, because it's safe and provides real-time images.
Yeah.
It's also useful for visualizing blood flow in certain organs.
But it has limitations in terms of depth and resolution.
Yeah, and finally there's PE scanning, which is unique because it measures metabolic activity.
Metabolic activity. So it's not just showing us the structure, but how active the cells are.
Precisely. This makes PE scans incredibly valuable for detecting cancer and heart disease because those conditions often involve changes in cellular activity.
Wow. So we've got all these different imaging tools, each one giving us a unique piece of the puzzle.
Exactly. And AI can make these tools even more powerful.
Okay, so how does AI actually enhance these imaging techniques?
Think of AI as a superpowered assistant. It can analyze these images in ways that we never could before.
Can you give us an example?
Sure, AI can be trained to spot tiny details in an X-ray that a human eye might miss. Or it can help automatically segment images in a CT scan to make it easier for radiologists to identify and measure tumors.
It's like having a second set of eyes, but with superhuman abilities.
Exactly. And as AI technology continues to advance, we can expect even more incredible applications in radiomics. But to really understand how AI is being used, we need to delve into the actual workflow of radiomics with AI.
All right, I'm ready to unpack that. What are the steps involved?
It's a multi-step process, but we'll break it down. First, we need to acquire the radiological images. Whether it's an X-ray CT scan, MRI, ultrasound, or PET scan depends on the clinical scenario.
So step one is getting the image.
Yeah.
Makes sense. What happens next?
Once we have the image, we need to segment it.
Segmentation, what does that mean?
It means focusing on a specific region of interest, or ROI. Let's say we're looking at a lung CT scan, and there's a suspicious area that might be a tumor. We want to isolate just that area so we can analyze it in detail.
So it's like zooming in on the most important part of the image.
Exactly, and AI can be a huge help with this. Traditionally, segmentation was done manually by radiologists carefully outlining the ROI on the image.
That sounds tedious.
Can be, but now we have AI algorithms that can automatically segment images with remarkable accuracy.
That's incredible, and probably more precise than doing it by hand.
Absolutely. AI can detect subtle boundaries and variations that might be difficult for the human eye to see.
So once we have the segmented ROI, what's next?
Then comes feature extraction. This is where we use computer algorithms to analyze the image and extract all those quantitative details we talked about earlier.
Like the size, shape, and texture you mentioned before.
Exactly. Those features provide the hidden insights that we're looking for.
So we're using computers to measure and quantify all those subtle characteristics of the image.
That's a great way to put it. But we're not done yet. The next step is pre-processing.
Pre-processing, what is that?
It's all about preparing the data for our AI model. We might need to select the most relevant features and maybe do some dimension reduction to make the data more manageable for the model to process.
Dimension reduction. Sounds complicated.
Imagine you're trying to describe a painting. You could talk about every single brushstroke, but that would be overwhelming and probably not very helpful. Instead, you might focus on the main colors, the composition, and the overall style. Dimension reduction is kind of like that. We're trying to simplify the data while still retaining the most important information.
So it's like finding the key elements that capture the essence of the data without getting lost in the details.
Exactly. And this pre-processing step is crucial for building a robust and efficient AI model. Once we have our pre-processed data, we're ready for the next stage, AI model development.
Okay, so this is where we actually build the AI model that's going to analyze these images and hopefully give us some answers.
Right. This is where we train our AI model to recognize patterns in the data and make predictions. Think of it like teaching a student to recognize different types of cells under a microscope. We show the model lots of examples and tell it what each one represents. Over time, the model learns to identify those patterns on its own.
We're basically teaching the AI model to be a super-powered radiologist.
You could say that. But of course, we need to make sure our AI model is accurate and reliable. That's where training, validation, and testing come in.
Okay, so we're putting our AI model through a rigorous training program to make sure it's up to the task.
Exactly. We start with the training phase, where we feed the model a large data set of images and their corresponding diagnoses. The model learns from this data, identifying the features that are most important for making accurate predictions.
So the AI is like a student cramming for a big exam.
In a way. But we don't want the model to just memorize the data. We want it to truly understand the underlying concepts so it can generalize to new unseen data. That's where validation comes in. We use a separate set of data to fine-tune the model and make sure it's not overfitting to the training data.
So validation is like a practice test to make sure the model can apply what it's learned.
Precisely. And finally, we have the testing phase, which is like the final exam. We use a completely independent data set to evaluate how well our model performs in the real world. We measure its accuracy, sensitivity, specificity, and other metrics to make sure it's ready for prime time.
This is all so fascinating. It sounds like we're really putting these AI models through their paces.
We have to. We need to be confident that they can perform accurately and reliably in a real clinical setting.
But how do we actually understand what's going on inside these AI models? Sometimes they feel like black boxes.
That's a great question, and it leads us to the final and arguably most important step, explainability.
Explainability. What does that involve?
It's all about making sure we can understand and interpret the AI model's decisions. It's not just about getting a diagnosis, it's about understanding why and how the model arrived at that diagnosis.
So it's about transparency and making sure we can trust the model's reasoning.
Exactly. We need to be able to trace the AI's decision-making process, see which features it considered most important, and understand how it weighted those features to reach its conclusion. This transparency is crucial for building trust and ensuring these models are used safely and effectively.
This is all really incredible. We've covered a lot of ground here, from the basics of AI to the intricate steps of a radiomics workflow. My mind is officially blown. But can we bring this to life with some real-world examples? I think our student listeners would love to hear how this all plays out in practice.
Absolutely. And the lecture notes actually highlight some fun activities that really showcase the power of AI. Let's dive into those.
Sounds like a plan. This deep dive is getting more and more fascinating by the minute.
So one of the activities they talk about in the lecture is image activities. And basically it's where students are given two AI-generated images,
Wow.
and they have to spot the one with like a defect or something.
So it's like a Where's Waldo, but for medical imaging.
Haha, yeah, kind of. It's
Yeah.
training your eye to see those subtle differences that might indicate a problem.
And this ties back to automatic segmentation, right? Like the AI models are doing a similar thing when they're analyzing real medical images.
Exactly. They're trained to recognize patterns and identify anything that looks out of place.
It's like giving the students a taste of what the AI is actually doing.
Yeah, it helps them understand the process and the importance of those subtle cues.
So what other activities did they talk about?
Well, there's another one called the memory matrix question.
Okay, that sounds intriguing. What is that?
Basically, it's a matching game where students have to pair medical imaging techniques with specific diagnostic scenarios.
Like a which tool is right for the job kind of thing.
Exactly. For example, which technique would be most appropriate for a suspected bone fracture?
Let me think. Based on what we talked about earlier, I'd say an X-ray would be the best choice.
Right, because it's quick, cost-effective, and great for visualizing bones.
What about if you were looking for a brain tumor?
That sounds like a job for an MRI scan.
Yeah, because it gives you those high-resolution images of soft tissues.
Precisely. So the memory matrix question really reinforces the importance of understanding the strengths and limitations of each imaging modality.
It's all about choosing the right tool for the job.
Exactly. In a real clinical setting, that decision can make all the difference.
This deep dive is really making me appreciate just how complex medical imaging is.
It's a fascinating field, and the integration of AI is taking it to a whole new level.
It's amazing to think about how AI and radiomics are already changing the way we approach healthcare.
And it's only the beginning. As AI technology continues to evolve, we can expect even more groundbreaking applications.
It's exciting to think about what the future holds. So for all our student listeners out there, this is definitely a field to keep your eye on.
Absolutely. The possibilities are endless. But now that we've explored the key concepts and seen some practical examples, I think it's time to step back and consider the bigger picture.
Okay, so where do we go from here? What does all of this mean for the future of healthcare?
Well, that's the million-dollar question, isn't it? How will AI and radiomics shape the future of medicine? How will it impact the way we diagnose and treat diseases?
It's almost impossible to predict, but it's certainly an exciting time to be involved in this field.
Imagine a world where AI can analyze medical images with incredible speed and accuracy, assisting doctors in making faster and more informed diagnoses.
That would be a game changer. Earlier and more accurate diagnoses could lead to earlier interventions and potentially better outcomes for patients.
Exactly. And think about the potential for personalized medicine. AI could help us tailor treatments to individual patients based on the unique characteristics identified in their medical images.
So instead of a one-size-fits-all approach, we could have truly customized treatment plans.
Precisely. And as AI continues to evolve, it might even be able to predict which patients are more likely to respond to certain therapies, helping us avoid unnecessary procedures and potential side effects.
That would be incredible. It's like having a crystal ball that can guide us towards the most effective treatment path for each individual.
The possibilities are truly mind-boggling. But of course, with any powerful technology, we need to proceed with caution.
Right. There are ethical considerations that we can't ignore.
Absolutely. We need to ensure that these AI systems are developed and used responsibly, always prioritizing patient privacy and safety.
We need to have open and honest discussions about the potential risks and benefits of AI in healthcare to ensure that these advancements are used ethically and for the benefit of all patients.
I couldn't agree more. Ongoing research and thoughtful dialogue are essential as we navigate this new frontier.
This deep dive has been an incredible journey. It's really opened my eyes to the transformative power of AI in radiomics.
Me too. It's inspiring to see how technology can be harnessed to improve human health in such profound ways.
And it's just the beginning. For our listeners who want to learn more, we've included some links in the show notes from the lecture that will provide a great starting point.
Those resources will be invaluable for anyone who wants to delve deeper into this fascinating field.
And who knows? Maybe some of you listening today will be the ones pushing the boundaries of AI and radiomics in the years to come.
That's what makes this so exciting. The future of healthcare is in your hands. Stay curious, keep learning, and never stop exploring the possibilities.
Well said. And on that note, I think it's time to wrap up this deep dive. A huge thank you to our expert for sharing their knowledge and insights with us today.
It was my pleasure. I always enjoy talking about this stuff, especially with future healthcare professionals who might one day be using these technologies to make a real difference in the world.
And to all our student listeners out there, we hope this deep dive has sparked your curiosity and inspired you to explore the incredible world of AI and radiomics. Remember, the future of healthcare is in your hands. Stay curious, keep learning, and never stop pushing the boundaries of what's possible.
The world needs bright young minds like yours to shape the future of medicine. Go out there and make a difference.
We can't wait to see what you accomplish. Until next time, keep diving deep into the fascinating world of knowledge and discovery. It's incredible to think that everything we talked about today might just be scratching the surface of what AI can do in radiomics.
Oh, absolutely. This field is moving so fast. What we know today could be completely different in just a few years.
It really makes you wonder what kind of amazing advancements are just around the corner.
Well, I think personalized medicine is going to be huge. AI algorithms that can analyze a patient's medical images and even their genetic information to create truly personalized treatment plans.
Wow, that would be a revolution in healthcare. It'd be like having a medical GPS guiding us toward the best possible treatment for each individual.
Right, and it's not just about treatment. AI could also help us find those people who are at high risk for certain diseases just by looking for subtle patterns in their medical images.
That's early detection,
Oh,
which is key for so many conditions. It could literally save lives.
exactly. AI has the potential to transform preventive medicine too.
I have to say, this deep dive has really opened my eyes to the incredible power of AI and what it can do for healthcare.
Me too. It's so inspiring to see how technology can be used to improve human health in such profound ways.
Well, on that note, I think it's time to wrap up this deep dive. A huge thank you to our expert for taking us on this journey into the world of AI and radiomics.
It was my pleasure. I always love talking about this stuff.
And to all our student listeners out there, we hope this deep dive has sparked your curiosity and maybe even inspired you to explore the world of AI and radiomics. Who knows? Maybe one of you will be the ones leading the next wave of innovation in this field.
That's what makes this so exciting. The future of healthcare is in your hands. So keep learning, keep exploring, and never stop pushing the boundaries of what's possible.
Well said. And until next time, keep diving deep into the fascinating world of knowledge and discovery.